topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello, everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. As always, my goal is to empower you with information to help you regain control of your health. Today, I have the pleasure of welcoming back Dr. Michael Schachter, a leader in alternative cancer therapies and the director of the Schachter Center for Complementary Medicine in Suffern, New York. Today's show is part 2 of a 3-part series of Searching for Answers for Cancer Patients. Great to have you here again, Dr. Schachter.
Oh, Elyn, it's a pleasure to be here.
Well, I'm looking forward to today's show. And, Doctor, in part 1, we discussed the current standard of care and why it is not always the best answer for cancer and certainly not the only option. So, in your opinion, what should cancer patients be focused on? What do you think they should be doing, and what are some of the other strategies that you might consider for cancer patients?
Well, the way things are now is that patients basically focus on conventional treatments. They focus on whether they should get surgery, radiation, chemotherapy, the targeted therapies, and this is what, in general, conventional physicians will talk to them on. And I have, I've been working in this field for more than 35 years with alternative cancer therapies, and I'm becoming more and more of the opinion that in some cases, or in many cases even, it may be better to just skip over and hold on the conventional treatments, since the results in many cases are really not very good and they can cause many adverse side effects. Instead, patients should be focusing, in my opinion, on various ways of how to become healthy. In other words, in most cases, the cancer has developed in an atmosphere or in an environment which promotes the cancer. And what you want to do is change that internal environment and see if you can get the body's mechanism. The body does have a number of mechanisms for helping to control cancer and even control it, or even in some cases get rid of it. And that's what I think people should be focusing on. So just to give you a word, a list of things that we can talk more about would be to focus on diet, changing one's diet, eliminating refined and processed foods, including added sugar, white flour, artificial chemicals, with an emphasis on vegetables, high-quality proteins, and high-quality fats. So that's the diet is probably one of the most, if not the most important thing to look at. The second thing is intelligent, limited exposure to sunlight directly without the use of sunscreens. And this has been very much ignored. And in fact, the last 30 years or so, there's been an emphasis by primarily the dermatology specialty to telling people to stay out of the sun, that it was dangerous. It can cause skin cancer, and that if you do go in the sun, make sure you put on plenty of sunscreen.
Toxic sunscreen.
Well, that's right. And then, of course, in doing that, you're blocking off the main source of the body's ability to form vitamin D, which is from sunlight. We convert the sunlight, actually cholesterol-type substance in the skin to vitamin D. And that's, we don't have that much vitamin D in our food. We have some, but not that much. And otherwise you have to get it through sunlight, and you have to get it through supplements. So that's the second thing. And then it would be sunlight. Then the third would be actually vitamin D itself as supplements, and perhaps perhaps much larger doses than are generally recommended by the Food and Nutrition Board. We can get into that in more detail. Use of other fat-soluble vitamins, such as vitamin K2, for which there's tremendous confusion among conventional physicians and science about that. But this has really, in the last 5 or 6 years, become an extremely important vitamin that people generally don't know much about. And most people think of vitamin K as involved in blood clotting, and that's the only function, but it has many other important functions, and we can talk about that. Vitamin A, another fat-soluble vitamin, also appears to be extremely important, works together with vitamin D in terms of improving one's immune response and controlling cancer. We, of course, also want to reduce exposure to toxic substances, whether it's in the diet or whether it's in the air or whether it's in the water. So these are all the kinds of things that I think people could be paying attention to, because right now our whole lifestyle is focused on things that are actually bad for one's health. For example, the tremendous emphasis on refined, processed carbohydrates, sugars, and starches, which increase the inflammatory process and increases cancer. The inflammatory process involved in just about every degenerative disease, where we talk about cancer or heart disease or neurological conditions or psychiatric conditions. These refined carbohydrates play a role in all of them, because they induce inflammation, and the inflammation then drives cancer and many of these other pathological processes. So we want to avoid toxic metals. If we have toxic metals in us, we want to try to get rid of them. This can include things like chelation therapy. It could include things like saunas. Exercise is a very important issue that I think needs to be emphasized and is not sufficiently emphasized. Supplements that have high-quality minerals that are balanced promote healing. Iodine is another supplement or another substance that is virtually ignored by conventional medicine, which basically says, well, all we need iodine for is to support the thyroid, and all we need is tiny doses in the form of iodized salt. Well, I will argue that that's not the case at all, that you need higher doses of iodine to help you to prevent against cancer, and that its function is involved in many other things besides the thyroid. Thyroid's important, but it also is involved in many other things. It's needed in every cell in the body. So iodine is something also that we could spend a little bit more time on. Then there are a whole bunch of other supplements that I have anti-inflammatory processes, and there are a lot of in vitro studies. There are even animal studies on them. But even though they show anti-cancer properties, they do not ever get to the point of, or very rarely will get to the point of randomized, double-blind, placebo-controlled studies. Now, should we define what that is, or do you think most of the audience knows what that is?
I think they do.
Okay, so those studies are generally not done for these natural substances, because they are not patentable, they are not drugs, they are not patentable, and there's no financial incentive to do those studies, and these studies are very, very expensive, costing millions of dollars. And so we don't have them, and then that's on the one hand. You have a kind of catch-22 situation. So on the one hand, we don't have the studies, and on the other hand, conventional organized medicine, conventional medicine says, well, if it's not double-blind, placebo-controlled, then we don't even want to talk to you about it. So it's a closed system. You never get to the point where you actually look at some of these very useful things with regard to helping to fight cancer. So
right. I was going to say, even with something like curcumin, we're finally making headway, but people still don't understand things in isolation don't always work. And,
I think that point is really worth taking. I mean, I'm finding more and more that you have to it's like a jigsaw puzzle, and if you just put one or two elements in, you're not going to get very far. You've got to get all these elements together, working together, and you will have to kind of devise a program for an individual. This is where the art of medicine, of nutrition comes in, something that's going to be practical, something that can be doable financially and otherwise for a person, so that they can live with the program that is developed for them.
Absolutely. It is about an individualized program, and everything does have to work synergistically. So, but I want to get back a little bit to that first thing you said, diet. Diet is so very important, and researcher Thomas Seyfried has become very, very popular among many integrative specialists and even a few conventional oncologists with his suggestion that the ketogenic diet may be a good diet for all cancer patients. And in fact, in an interview you did with me, you discussed the ketogenic diet and implied that it might be good for all cancer patients. Do you still feel this way, or have you modified or changed your views in any way?
Well, I have modified my view somewhat on that. Part of that was influenced by my friend and colleague, Dr. Nicholas Gonzalez, who did an 8-part series online that anybody can get to if you just Google Nicholas Gonzalez and the ketogenic diet for cancer. You can get this 8-part series and you can read it yourself. He makes a number of points. First of all, just for those who may not be totally familiar with the ketogenic diet, the ketogenic diet is a diet which is really high in good fats, moderate in protein, and really low in carbohydrates. So it's the absolute reverse of what, in general, the government and the Food and Nutrition Board recommends, which recommends a real high carbohydrate diet. Now they say, well, it should be whole grains and vegetables and fruit and so on, but that should be like 70% of your diet. And this ketogenic diet says, no, it should be more like 5 or 10%. And the fats, the government, the Food and Nutrition Board, will then basically talk about fats being maybe 20% of your diet, and this is saying, well, no, it should be more like 70 or even 80% of your diet should be good fats. And then the proteins they don't vary that much in the proteins. It could be somewhere around 10, 15, 20, 25%, something like that. So anyway, that's what the ketogenic diet, the term refers to the formation of ketones. And ketones are certain specific organic compounds which are formed when fat is metabolized in the body. When fat is broken down, it forms ketones. And Seyfried's idea here is that ketones are generally not utilized very well by cancer cells, but are used fine by normal cells. So you can actually get normal cells to utilize these ketones and these fat substances for energy, and they'll do fine, but the cancer cells which really crave sugar and want to use carbohydrates will not do as well. And in general, I would say, a person, for example, on a ketogenic diet will certainly do, in most cases, a lot better than somebody who's on a junk food diet, the usual typical American.
Of course.
So,
the diet of eat all the calories you can just so you don't lose weight? Yeah, that's
right. Well, this is what oncologists frequently will say. Just eat whatever you want, as long as you eat enough calories to prevent you from losing weight while you're on this conventional treatment program, which will generally cause loss of appetite and cause you to lose weight. To lose your weight. So they want to keep your weight up, but they don't really take into consideration much the fact that the cancer really tends to feed and develop on high sugar diets, and so and basically all of the degenerative diseases tend to do that. So, but getting back now to, so what are the problems with the ketogenic diet? Well, Nick Gonzalez points out, and I agree with him, Dr. Seyfried wrote a 400-page book called The Metabolic Basis of Cancer. I think that was the title, something like that. And it's an excellent book, and it's tremendous science. There are a lot of research references in it. But the fact is, he only has 2 cases of so-called patients who supposedly did well on a ketogenic diet, 2 patients with cancer, and those patients were not very good. Actually, they weren't really good examples of this. What Gonzalez points out is that many of the alternative cancer therapies that have been very successful, like, for example, the Gerson program and others, the Hippocrates and some of the patients that he's worked with using the Kelly program, that these patients who had stage 4 cancers and were living, way beyond what was predicted for them, sometimes 15, 20 years, these people weren't necessarily on a high-fat, low carbohydrate diet. In fact, many of them were on a pretty high carbohydrate diet, but it was not the refined carbohydrates. It was the carbohydrates, from vegetables, some fruit, possibly whole grains, and so on. So he points out that most of these real good success stories are people who have been on a relatively high carbohydrate diet. So, in any event, that has caused me to rethink some of this, and that maybe the ketogenic diet is not necessarily the best thing, but many of the direction of the ketogenic diet, for example, having people have good quality fat in their diet and not be afraid of fat. We have been fat phobic in the United States for probably the last 40 or 50 years, and during that time, diabetes has tremendously increased. Cancer has increased in certain kinds, and this in part and heart disease also. All of these things are triggered, and the gain in weight, the obesity epidemic, is largely a result of the tremendous increase in carbohydrates. And so the government, by pushing carbohydrates and telling people to lower their fat, in a sense, has played a role in promoting this epidemic that we have of these various diseases. So I do believe that you can have a relatively high-fat diet, good quality fat, and it can be very healthy for cancer patients. But I don't think you necessarily have to go to the extreme of making it ketogenic.
Okay, so along the lines of diet, it is very, very difficult for cancer patients, because they go to someone like you, they go to somebody else, they pick up a book on the bookshelf, and everybody has a completely different opinion on diet. And I know I get clients all the time that say, but he says I have to do this, and she says I have to do that, and either it doesn't resonate with them or they're all conflicting. So I'd like to talk about that, and I'd also like to talk about Dr. Keith Block's book, Life Over Cancer. He has a very different approach, and many practitioners of holistic medicine like Andrew Weil and authors such as Ralph Moss and many others regard Dr. Block as the most prominent integrative cancer specialist in the United States. But in what areas would you agree and disagree with his philosophy?
Well, I have a great deal of respect for Keith Block. Dr. Block, I've known him not well, but I've known him. We've appeared on programs together for probably at least 25 years. In fact, in March, he and I are both going to speak at the Annie Appleseed Project conference in West Palm Beach, Florida. And he is the keynote speaker on Friday, and I am the keynote speaker on Saturday. And
I'm looking forward to having dinner with the two of you down there.
Well, I would look forward to that too. And unfortunately, he won't be at my lecture, but I'll be at his. And I think we need to. The main difference, I think, between us is that Dr. Block has really gotten himself involved very intensively with oncologists. So the Block Center really tries to incorporate and integrate conventional treatment, radiation, chemotherapy, surgery. Several points in his book, he does mention that he would, for example, have encouraged a patient with prostate cancer to go ahead and do the conventional treatment because the patient had refused to do it. And from my point of view, I would not have recommended conventional treatment for that patient. That's one example, and there's several other examples where he emphasizes very much that he and his staff really tried to get the patient to do the conventional therapy, but the patient didn't want to do it, and so didn't do it. So what he does is most of his book, called Life Over Cancer, is spent working on nutritional principles and nutritional supplements that are designed to help to reduce the adverse side effects of the conventional treatment. Now, he argues that if you incorporate nutrition, supplements, lifestyle changes, exercise, good sleep patterns, etc., into your program, you will get much better results than if you just do the conventional therapy and listen to what most oncologists say, which basically is it doesn't matter what you eat, just make sure you get enough calories in. Certainly no encouragement for things like sunlight or supplements. In fact, many times they'll say supplements will interfere with conventional treatment. You better not take any. So Dr. Block does not take that point of view. He's saying that, there are many places where, in fact, he did a meta-analysis, a study that showed that in general, people who did do supplements with their conventional program, not only didn't it interfere, but in many cases seemed to improve the results of that. So that's where he's coming from, and he's done a great deal to get more acceptance among conventional people for integrating nutrition and supplements into their program, and I admire him for that, and he's done a wonderful job. And I think he probably is certainly a lot more diplomatic than I am when it comes to things like that.
Well, I understand, but I think he has done an amazing job of educating other doctors and
absolutely
people. I think it's amazing, because if you go backwards in time a little bit, nobody was going to let you take any supplements or even discuss diet, right? And he's at the forefront of saying, "No, guys, you've got it all wrong." Yeah, we have some research, right? So he's done.
So I admire that. That all being said, I'm going to take it a step further, and I'm going to say, well, maybe in some cases, and more in many cases, maybe we shouldn't be focusing so much on the conventional treatment shouldn't be taken as a given. The breast cancer protocol, for example, of surgery, lumpectomy, then going ahead and doing radiation, and then probably doing chemotherapy or doing an anti-hormonal therapy like tamoxifen if you have an estrogen-sensitive tumor. That's, kind of the given, and he accepts that as the given, and then let's also do some nutritional support and so on along with that program. And in many of our patients, we have patients who, for example, will do a lumpectomy and then come here, and we talk about the pros and cons of radiation and chemotherapy, and they wind up, after thinking it through, deciding not to do the radiation, because there really isn't any evidence that I am aware of that radiation following lumpectomy improves the survival time or prevents the occurrence of distant metastases in breast cancer patients. And so rather than going through the dangers of radiation and some of the adverse effects of these drugs, they instead focus on trying to change this internal milieu, this internal environment that allowed the cancer to develop in the first place, and just focus on trying to become healthier and healthier. And so we have more and more patients that are actually kind of driving this thing, I think partially as a result of the Internet, partially as a result of people like you that ask patients to look at this and not necessarily be bullied into doing things that really don't make any sense to them. So many more patients are doing this, and so what I'm doing is I'm saying, maybe we should not take the conventional treatment as a given, but let's look at what are the pros and cons of doing conventional treatment, what are the pros and cons of doing these other things that I've been talking about, and in many cases patients may decide, that's not for me. I'm not going to do the conventional. Let's see how I can do without doing it. And we have patients, living for 10, 15 years and so on, who have chosen to do something like that without ever having done any conventional treatment.
Right. And I think a lot of times people misunderstand the treatments when they say, well, the 5-year survival rate is great, or the 10-year survival. But I always look at it, well, that's great, but you also don't want to give up tomorrow for today. So you're just going to do these treatments so you can live 5 years. Well, the goal should be to live far longer than that, and not be sort of misled that these... Well,
I couldn't agree with you more. I think patients are often really confused. I mean, I had a patient came to me the other day, and she's who has a uterine cancer, and that has spread, and she was told by this oncologist that he's going to treat her with chemotherapy and he's going to cure her. What does that mean, cure? I don't even use the word cure, because I've got so many patients that have come back, sometimes after 13, 14, 15 years, and have a recurrence of the original cancer. So what do you mean by cure? So I don't even like to use the word cure, but I think the patient really is really fooled in this kind of situation into believing that all I have to do is do this chemotherapy and I'm going to be cured. But the fact is, that chemotherapy is rarely curative, and maybe in some cases it doesn't improve survival time compared to doing nothing. But in those cases, those are often patients who've not done any of these lifestyle changes, etc. So it's really a little bit hard. But I agree with you. I don't even think in terms of a lot of times people are in their 40s or 50s, 30s, and you want to think in terms of 30 or 40 years, not just 5 or even 10
5
years.
or 10, right. Absolutely. And that's really when people come to me, because they say, I'm very confused. Everyone's telling me I have to do this, but this doesn't make sense to me. And then we have a nice long conversation, and it's good. It's all good. But again, it is confusing. But what about David Perlmutter? Let's talk about his book for a bit. The Grain Brain.
Oh, I think that's a fabulous. David is a friend and a colleague of mine, and I've known him for many years. And he now has this book called Grain Brain, which has actually been #1 on the Times bestseller list, which is absolutely unbelievable. I just heard him lecture again. His lectures are just fantastic, and he's always with humor and very, very clear in terms of where he's going. So I heard him lecture actually Sunday. And he continues to be great. The main point of this book is, hey, sugar, grains, gluten, etc., really increase your risk of developing Alzheimer's disease or dementia. And he points out, he shows how the process of eating sugar causes an increase in blood sugar, and carbohydrates increase your blood sugar, which results in what he calls what we call glycating proteins. In other words, the glucose attaches itself to proteins in the body, and when that happens, it increases oxidative stress or free radicals, and it increases the inflammatory process, which is the cornerstone of all of these degenerative diseases, whether it's Alzheimer's disease or heart disease or neurological diseases or cancer. And so his point is, we really should be on a diet that drastically reduces that. The hunter-gatherer generally did not have diets that are high in carbohydrate. I mean, we've only been growing grains for the last 10,000 years, and that our genes have not adapted to it, and what we have now is this epidemic of obesity is largely the result of people eating much too much carbohydrates and insufficient fat. And he argues very strongly that we should be reducing our carbohydrates significantly. We should be increasing healthy fats, and that this is the first step in terms of really trying to reverse the obesity epidemic, the diabetes epidemic, and so on. And so I think it's great.
Yeah, okay, so we're going to eat our lean protein, we're going to eat healthy fats, and lots of vegetables. So then I'm going to change the topic a little bit. In December, there was a major media push to denigrate the view that vitamin D may be helpful as a strategy for preventing and treating cancer, as well as a number of other conditions. For one example of a headline we had from Medscape for physicians, large review casts cloud over vitamin D health benefits. Have some thoughts there?
Oh, I have some very, very strong thoughts about that, as you might imagine. This study was led by a Professor Philippe Autier, I think I'm pronouncing his name right, from the International Prevention Research Institute in Lyon, France. And what he said, this is a quote from him, I believe, from the study: if the health benefits of high vitamin D concentrations shown by data from observational studies are not reproduced in randomized trials, and he has parentheses, the gold standard method for assessing a causal relationship between exposure and an outcome, then the relationship between vitamin D status and disorders are probably the result of confounding or physiological events involved in these disorders. And so, as a result, he says, well, we have a whole bunch of interventional studies, and none of them show any benefits. And therefore, forget about vitamin D. It really has nothing to do with benefits. Even though we have, loads and loads of studies that show what are called observational studies, epidemiological studies that show that the higher the intake of D, the lower the various diseases that you can look at, hypertension and cancer and heart disease and all kinds of other things. But they don't mean anything because these interventional studies fail to show any benefits. So that's very interesting. But the question then is, well, how do they do these interventional studies? Well, it turns out that virtually all of these interventional studies were done with vitamin D levels that were too low to do anything. They were done by what the Health and Nutrition Board, Food and Nutrition Board recommends as being enough vitamin D for people, which was 600 units a day. So 600 units a day, they did a whole bunch of studies and they saw no events. So therefore they're saying vitamin D is no good.
So wasn't there a study? Oh, sorry, go ahead.
Yeah, go ahead. What were you going to say?
I was going to say, wasn't there a study back in 2007 that showed fantastic results at even only 1,100 units?
Well, yes, there was. And, of course, I don't think he mentions that in his paper at all. But there was a study back in 2007 that was published in the it was published in the American Journal of Clinical Nutrition. And this was a study where they took women in the Midwestern town or area. There were 1,100 women, or over 1,100 women, almost 1,200 women. They were healthy postmenopausal women, and they were 55 years or older. It was in the Midwest. And they divided them up and they gave them three groups. There was one group that got 1,500 milligrams of supplemental calcium alone, a group that got supplemental calcium plus 1,100 units of vitamin D. Now, this is 1,100 units. Keep that in mind. So it's more than the 600, but it's not that much more. Or a placebo supplement, and they showed that there was a drastic reduction in the women, the incidence of cancer in this group. It was like something like 60%. I don't have the figure in my head here. 60% of the women reduction in cancer in that group. Now that's, can you imagine if you just gave everybody in the United States, 1,000 or 2,000 units of vitamin D a day, what that would do to the incidence of cancer? And so Life Extension had an article, saying that, let's just supply every adult in the United States with, I think they said 1,000 or maybe 2,000 units of vitamin D a day, we would drastically reduce our cancer incidence and so on. So that study is totally ignored. So that's the only interventional study. You would think, well, if that intervention was so successful, well, gee, by now, 2007, we're now in 2014, 7 years later, there must have been another 15 or 20 studies with 1,100, 2,000, 3,000, zero. There have been no studies whatsoever looking at this. Why? Because there isn't the financial incentive for companies to spend all kinds of money to do this kind of research, because the vitamin D is not patentable. So this is the major thing. Now, there's from my point of view, I believe that vitamin D is extremely important as part of a nutritional supplement program for cancer patients. I think it's important to prevent cancer, but I think much higher doses are needed if you want to treat somebody who has cancer.
So let's talk about that. What role does it play, and really how much should we be taking?
Okay, well, the vitamin D level, you can check the vitamin D level. The 25-hydroxy vitamin D is the blood level that can be used to determine the nutritional status of vitamin D in the body. That's the best one to use. And the normal range in most labs are between 30 and 100. Now, it turns out even with that wide range, a significant percentage of the American population are deficient. They call 20 to 30 insufficient, and they call under 20 deficient. And so there's still a very high percentage of people that are deficient. In terms of what appears to be much more beneficial for patients would be to start to run the levels more up around the 60 to 100 range. There doesn't seem to be very much evidence of toxicity unless you go above 150. And there are certain other nutrients that you can take to help to prevent toxicity from vitamin D, such as K2. We'll get into that in a few minutes. But I like to see my cancer patients' blood levels move toward 100 rather than down around 30. And the fact is that the vitamin D plays an unbelievable role in there are something like 3,000 studies that indicate that vitamin D. Now these are in peer-reviewed journals. These are not in the throwaway things. 3,000 studies indicating that vitamin D levels are associated with cancer. The lower the level, the higher. 75 epidemiological studies show an inverse relationship between sun exposure and vitamin D levels on the one hand, and the incidence and mortality of various cancers such as colon cancer, breast cancer, prostate cancer, lung cancer, all of them. And vitamin D upregulates or downregulates something like 3,000 genes. Now, what that means is the vitamin D can turn on various genes to get them to work to produce proteins. And what it does is it turns on anti-inflammatory, anti-cancer genes and turns off pro-cancer, pro-inflammatory genes. So that becomes an incredibly important thing, and this is what we're trying to do. So the research indicates that vitamin D works on all phases of cancer, and there is a nice YouTube video by Cedric Garland, who's a PhD who's done a lot of the research on vitamin D. It's a 15-minute presentation that people could look at. It's Cedric Garland, Garland, and it's they use the term dynamites model of cancer, with dynamites, each letter standing for a particular aspect of the development of cancer, like disjunction or uncoupling of cells, initiation, natural selection, overgrowth, metastases, and so on. And they point out that vitamin D plays a role in all of them. All of these different areas. So, to me, vitamin D is very important, and I consider it as being absolutely essential as part of a program. It's amazing to me, in spite of all of this research, conventional docs, they don't even talk about vitamin D. They don't measure it. They don't look at it at all.
Right. They're getting there now, but they're still not in the where they need to be, anywhere close to where they need to be. So
right.
You mentioned this briefly. What precautions should we should really be taken when we're taking vitamin D?
Well, the adverse side effect that seems to be associated with is the development of an elevated calcium, hypercalcemia, and that can occur because vitamin D is involved with encouraging calcium to be absorbed in the gut, and it helps to reduce the phosphorus loss, and calcium and phosphorus go together. But what it doesn't do is it does increase this calcium. The question is, what does the body do with it? Well, it turns out that research in the last few years have indicated that there's a vitamin called vitamin K2. It's related to vitamin K1, which is involved with blood clotting, but it has a totally different function than vitamin K1. And that vitamin K2, its role is to move calcium around the body. And that's a very, very interesting concept. For example, there is a condition that I'm sure most of your listeners have heard of called osteoporosis, which is a thinning of the bones, where the bones have lost bone density, and where a variety of drugs like biphosphonate drugs are used today to treat it. I never use biphosphonate drugs myself. What we want to try to do is to build the bone naturally, and you do that by having the calcium stick to or combine with a protein in the bone called osteocalcin. And guess how that's done? Well, it's done by having the osteocalcin activated by this vitamin K2. So when osteocalcin is activated by vitamin K2, it allows the osteocalcin to bind or chelate the calcium and hold on to it and prevent it from leaving the body, leaving the bone. So that, to me, is an important. So it actually, vitamin K2 is approved in Japan as a drug to treat osteoporosis. There are a couple of different types of vitamin K2. One of them is called MK4, and in Japan, that is approved as a drug at a dose of 15 milligrams 3 times a day to treat osteoporosis. Now, so that's one thing that's very important. But another aspect of this is we want calcium to be where it belongs, which to a great extent is accumulating in the bone, but we don't want it to be in other areas where it can be harmful. So we don't want it to be in joints where it gives you pain in your joints, where you can develop various little nubs on your joints due to abnormal accumulation of calcium. We also don't want it in our coronary arteries or in our arteries in general, where the calcium can combine with lipids or with fats, and it contribute to atherosclerosis and various other heart conditions and various other and you know, our number one killer is heart disease. So what the vitamin K2 does is it helps to keep the calcium in the bone and helps actually to remove it from the soft tissues where it doesn't belong. So I have incorporated now, I don't use vitamin D unless I'm using vitamin K2 at the same time. So this becomes an extremely important thing to think about and to use. There's a wonderful book I'll mention if people are interested in learning more about this, or they can also see a YouTube about this. The book is called The Vitamin K2 and the Calcium Paradox. And it was written by a Canadian woman naturopath named Kate Rumblou. And Dr. McCullough on his website did a 90-minute interview of her. So if you go onto YouTube or you go to his website and put in vitamin K2, you can see this wonderful interview by her. And I learned a lot from reading the book, and I learned a lot from listening to her. And I've incorporated some of these ideas into my own practice to be able to help my patients. And quite frankly, I take it myself, too, to help myself.
Mm-hmm. Okay. We're going to run out of time here, so I want to get moving a little bit along here. So we are going to have to be careful about our vitamin D, use it wisely, but it's really a great thing. There also, well, maybe you want to just talk a little bit about the K2 and the calcium within the arteries?
Well, yeah, that's what I was just saying. That the vitamin K2 helps to remove it. That's one of the things that it does, and you can actually you can do this. There's a test called where you can get an idea doing a CAT scan of the calcium score index, how much calcium is deposited in your coronary arteries. I'm not sure if they've done studies on this yet, but I assume that they'll be coming pretty soon. I believe you'll find that as you take vitamin K2 over several months, you'll see that the calcium score actually goes down. There's really not much to do it. We do chelation therapy with EDTA, and that's one of the things that it improves circulation. There was a recent trial to assess chelation therapy that we actually participated in that showed that there was improved results and prevents cardiac or various bad events for people who've had heart attacks. Now, I would think that vitamin K2 would be extremely synergistic with a chelation program and work very well with it. So K2 is very important. I think I also, perhaps maybe we should mention something about vitamin A as well. Okay. So vitamin A has gotten a bit of a bad rap, even by such esteemed organizations that I have tremendous amount of respect for, such as the Vitamin D Council, which talks a lot and is trying to get people to become more aware of the vitamin D problems. But they point out that vitamin A, when taken in large amounts, will tend to lower the 25-hydroxy vitamin D level, so they caution about it. And I think their point is well taken. You need to take these things in balance, and that's the important issue here. You need to take them in balance, because vitamin A will, to some extent, lower vitamin D levels, 25-hydroxy D, but they work as a team in the body. So vitamin A has many different characteristics. For example, it's needed for color vision and low light vision in the eyes. It is necessary for the health of all epithelial cells in the body for repair and to repair any damage. It helps cells to differentiate and enhances the immune system. So basically the vitamin D and the K2 and the A kind of work as a team, and they should not be seen as just opponents. I mean, usually my tendency nowadays has been to give pretty much equal amounts of vitamin D and A in international units. So, for example, if I give 5,000 units of vitamin D a day, I'd like to give 5,000 international units of vitamin A a day. And I balance in this way. And vitamin A, I look for dry lips or headaches as being an indication that maybe a person's getting too much and has to cut back on the dose. So all of these things are individualized and needs to be looked at. But in general, the principle of either having a real high A and a low D or vice versa, I think is not a good idea. You want to have pretty much equal amounts of those two.
Okay. All right. If there's nothing else on A you want to cover, we only have about 5 minutes left, so maybe we could address the role of iodine if we have time. If not, we'll continue. Okay.
Sure. Iodine is also another nutrient. I have lectures that I've given called Iodine, and I've included in my papers Iodine, the misunderstood nutrient. Dr. David Brownstein is also, he's more originator of that concept than I am, but I picked up on it also and believe that iodine is an extremely important nutrient. Now, conventional medicine generally regards iodine as being good in tiny amounts to help to support the thyroid and microgram doses. In milligram doses, they mostly think of it as a toxic substance that is dangerous. And on all of my patients, cancer patients and non-cancer patients, I do a threshold urine iodine when they come in. In other words, a randomized urine sample, and we send it. Any lab will do it. They check the iodine level, and I find that using the governmental statistics that the iodine levels that I get are frequently in a deficient area. Now, iodine was used by Dr. Max Gerson, who's an alternative cancer specialist who wrote in the 50s and 60s and had a book out called 50 Cured Cases of Cancer, and part of his program was a substance called Lugol solution, which contains iodine. It contains iodide, sodium iodide, or potassium iodide, and elemental iodine. And that's a liquid form. The tablet form of that that's most used nowadays is called ioderol. And I try to have all of my cancer patients. It's amazing. I'm seeing some cancer patients who coming from integrative physicians, and they have millions of herbs and all kinds of things on them. And when I check their iodine is in the deficient range. And I think that's a big mistake. I think because you need milligram doses in order to be able to help the body fight cancer.
I will tell you that I've never had a client come to me who has had their iodine checked.
Yeah, it's an amazing thing, and yet this is something that I check on every patient, cancer patients and non-cancer patients, and I'm amazed that, well, not anymore, but at the beginning I was amazed to see how many people were really very low in iodine because, first of all, a lot of people are told not to eat salt, and iodized salt is one of the main things. They don't eat seafood, they don't eat seaweed, and those are the main places where iodine comes from. And if you don't eat those things, you're going to be low in iodine. I mean, the Midwest, we used to have goiters, we still do to some extent, large thyroid glands. That's due to severe iodine deficiency. And women who are iodine deficient that have babies have these babies called cretins that are mentally impaired and intellectually and often die at a very young age unless they're treated.
Right, and now our iodized salt is useless. We're afraid to eat the seaweed. We're afraid to eat anything out of the ocean for fear. So it's only going to get worse.
Well, that's right. And this is why I think it's really important to probably have an iodine supplement again. And you have to be careful with iodine. You just don't take them willy-nilly because most of us are overloaded with another substance called bromine, which is related to iodine, but tends to be toxic. And when we start taking iodine, unless we've done various precautions, you wind up mobilizing the bromine from the tissues and causing a variety of side effects that say, the iodine has caused all these adverse adverse effects. Well, not really. What's happened is you've mobilized bromine because you haven't done other things like making sure there's sufficient salt and water, you're drinking enough, you have enough magnesium, you have enough selenium, you have enough vitamin C. All those things need to be present before you start really administering iodine as a supplement.
Okay, so we'll think about this. Maybe we'll talk a little bit more in part 3.
Yes.
Right, because this is the end of part 2, folks. If you missed either, part 1, you can see it via my site or Dr. Schachter's site, which we'll get to that in a minute. But we will continue this conversation in part 3 in February. I'd also like to mention, for all of you who follow the Sylvestrals, that Sylvestrals Journeys to Wellness by Brian Schaefer is available now, so you might want to check it out. In that, you will get the case studies that I know all of you are very, very interested in hearing about. So to replay previous interviews with Dr. Schachter, again, you can see my website, visit the Survive and Live Well replays. You can, for more information on topics discussed or DVDs of lectures by Dr. Schachter, visit the Schachter Center website at www.schachtercenter.com. If you missed part 1, again, you can replay it via iHeartRadio Talk under the header Speakers, or via my site as well as Dr. Schachter's site. And thank you again, Dr. Schachter. Always.
They may want to spell Schachter because probably people won't have a problem. It's SCHACHTER, SchachterCenter.com without any spaces. If you go on that, you'll see a lot of information about a lot of this stuff.
Right, more information than we got to today. And then remember, we'll have part 3, I believe it's February 11th, and we'll wrap that up. So thank you very much, Dr. Schachter.
Elyn, it's my pleasure. It's always great to talk to you.
Well, thank you. And folks, this has been Survive and Live Well, Tips to Treat and Beat Cancer on Cancer Support Network W4CS.com, where you can listen live Tuesdays at 1 p.m. Join us next week when I chat with Dr. Susan Kelderbank about oral complications during cancer treatment. If you missed any part of this show, you can catch it on my website, www.elynjacobs.wordpress.com. This is your host, Elyn Jacobs, one-on-one cancer coaching, empowering you to treat and beat cancer. See you next week.
If I have to.